Everyone, so today I'm going to tell you all about the care plan on adenomyosis with hypertension and hypothyroidism. Okay, so this care plan this is for the gynecological cases. Okay, so first you'll have to mention the identification data of the patient, the name, the age, the religion, then their education, what is their income, then which hospital they are admitted in, the ward number, bed number, when they were admitted, then what is their diagnosis, and if they will undergo any surgical procedure or not. Next come the major symptoms on hospitalization. So why were they admitted to hospital, that also you all have to mention. Okay, so here I have mentioned everything. Next come the present medical history. So here you all have to mention what is the present diagnosis of the patient, then which medication she is on, and also if she is having any history of past illness, that also you'll have to mention. Then what medication she is on, that also you'll have to mention. Okay, so here see I have mentioned everything, that the patient was diagnosed with adenomyosis with hypertension and hypothyroidism, and then she is taking medication such as the iron and calcium tablets, and also she had hypertension. Okay, so everything is mentioned. Next is the present surgical history, and then comes the past medical history. So here you all have to mention that previously what was the condition of the client. So here you can see I have written that the patient had heavy menstrual bleeding with the passage of blood clots from past 3 years she is having, and she was started with OCs for 5 months. Okay, and again the patient came to hospital with with the same complaints, and there she was given medication, and along with this she has the history of hypertension. Okay, so everything you all have to mention in detail. Then comes the past surgical history, then is the personal and nutritional history, then comes the gynecological history. So here you all also have to mention the obstetrical history. Okay, so you all can go through this. Next come the family history, and then family genogram. Now in family genogram you all have to mention 3 generations. Okay, next is the socio-economic history and environmental history. Then comes the vital signs, then is the physical examination, that is head to foot assessment, everything will come. Okay, so here I have written everything very nicely, you all can go through this. Okay, copy the same thing. So skin, head and face, hair, eyes, ears, nose and sinuses, mouth and pharynx, neck, lungs, heart, breast, extremities, back, pelvic examination, reflexes. Okay, so you can go through that, everything I have mentioned. Next come the investigation. This you all will find in the patient's case paper. Now because this is a gynecological case, so you all have to mention the USG report. Okay, ultrasonography report of the patient if taken. Then you all have to mention that you all have to mention on what medication the patient is. Okay, so I have very nicely elaborated and written everything, you all can go through this. Okay, so the dose, route, frequency, the action of that medication, what is the indication, contraindication, the side effects, and the nurse's responsibilities. Okay, so AMLO also I mentioned, and then is thyronorm. Okay, because she has hyperthyroidism. Okay, so everything very nicely it is written. Next is the nursing process. You all have to write what problems you identified in the patient, and according to that nursing diagnosis have to be framed. So I have mentioned your 5 nursing diagnoses. Okay, from this 2 actual and 1 potential you all have to explain. Okay, so see, you all can go through this. Okay, then is the nursing care plans. Okay, so here for acute pain you can also draw the pain scale. Okay, so here you all can mention like 1 to 10 number, and then you can draw the pain scale. Okay, the same thing you all have to mention. Then decreased cardiac output for hypertension, and there is knowledge deficit. Okay, for the disease condition, the same thing you all have to mention. Next you will have to write what health education you will give to patient. So that is written diet, exercise, hygiene, and medications and follow up. Okay, then is the progress note. So you'll have to write whether during your time the condition of the patient, whether it was improved or it was deteriorating. Okay, and next is the bibliography. So here I have mentioned the bibliography. Okay, you can mention more bibliographies if you all are referring that, or else this many are enough. Okay, thank you.